rather than, and that's the problem. I think integrative medicine, Eastern medicine should be, majority of the time your first option. And if that can't help and it's too severe that you do need medication or surgery, then absolutely go down more of the westernized route. But it's always the last resort. So by the time people usually come to me, unless they already know about it, they're coming to me and they've already been suffering for years. They are on a shitload of medication. They have had numerous amount of surgeries. And it's like, now we're dealing with chaos rather than a clean slate.
Yeah.
And it's difficult. You know what I mean? That's why my treatments are an hour. I don't just see a patient for 10 minutes. I'm with them for a full hour every single time.
Which is awesome because I've gone to people that kind of rush it, and
Yeah.
it's nice when someone spends the time because
Yeah.
you feel like you're getting it out. You're getting a lot out of the appointment.
Right.
You're not just okay, next, like
Yeah.
that conveyor belt type
Absolutely.
feeling.
And you need both medicines, 100%. I mean, look at everything that I just went through. I appreciate Western medicine so much.
Yeah.
You know what I mean? But my recovery was 10 times better because I was treating myself. And
Which I'm sure helped a ton.
Oh, tremendously.
Yeah.
Tremendously. They thought they had to do another surgery, and I was able to fix it. And he was like, oh, we don't have to do it. I was like, thank God.
Yeah.
Yeah.
Yeah, because you went through.
I mean, I'm getting another surgery, but that's for another.
Yeah, you told me.
Yeah.
Yeah.
Second part of it, always.
Is it?
Yeah.
Is
It's
it-
usually, there's always like a second part to the double mastectomy, unfortunately, to kind of more reconstruction. But I'm also having issues with one side that unfortunately you don't really know. Like, nobody really warns you about these things. And that's why I'm such a big advocate to talk about
Which is why
things.
we're going to go A
Yeah.
to Z.
Yeah,
And
perfect.
Although this episode is about you as a whole,
Yeah.
this episode also is about
Oh,
warning
I
women.
hate really talking about myself. So if we could talk about breast cancer,
We
I'd be
can.
very happy.
We can. We definitely can. I think we'll end off on the medicine stuff. So when did you, I think we'll end off like this.
Yeah.
When did you get your final doctorate? Because I know that was recently.
So this was this past January. Yeah.
Congratulations.
Thank you. Thank you.
Hard work.
Yes.
A lot of hard work. How many years?
Yeah. A lot of many years.
Many years
Many
of
years.
studying and classes and
9 years total.
yeah.
8 years total.
And here you are making a huge difference
8
in how
years.
many people's lives. I mean, so
Yeah.
that it's worth the
And
investment.
my practice, my patients are like my family. Like that's the thing. I know everybody by their name. I see usually anywhere from 30 to 35 patients a day. And every time it's an hour. I usually see 3 people in an hour, 4 maybe, depending. But I work a full schedule and every single patient is embedded in my brain. Like, I truly love them, and it's just amazing seeing their success, and it's just, I know I'm in the right field.
That's awesome.
Yeah, I love what I
that.
do.
I love that. So
Stressful, but I love what I do.
yeah, you like anything. This
Right.
stuff is stressful too.
Oh, yeah.
I get it. So
Yeah.
we all have our own individualized stressors for
If
every
it wasn't
job.
stressful, then you're probably not doing it right.
Yes.
I hate to say it.
Yes.
Yeah.
As you can see, I'm still trying to organize. I just set up a new thing. That's my new monitor over there. That's my
Love
old
it.
computer. And this is the new computer. So I'm trying to rearrange things and clean things out.
And the alcohol.
And the alcohol. Yeah, there's just alcohol there. If you want to booze mid-podcast,
Perfect.
it's
Yep,
there.
I love
mean,
it.
we try to be a good host.
I love it. I love
You
it.
got puppy you can scratch, alcohol you can drink. What more could you want?
You really can't.
I know.
This is everything.
So I think it's important, obviously, to give our female listeners
Yes.
every possible
Detail.
detail and piece of knowledge
Mm-hmm.
about your journey, what you went through before, prior,
Yeah. Mm-hmm.
finding out. The females that I've spoken to about you coming on, they've been so interested in hearing it because it's something that
It's personal.
people can't shy away from. You have to face this literally
Head on.
Head on.
Yeah. Yeah.
So what kind of got you the first dose of information on that?
So
And what is it called officially?
So since I was 19 or 20 years old, I started developing tumors in my left breast. And since I was 20, I'm 28 now, I've had 11 biopsies. And anyone who's had breast biopsies know that it is like inhumane. It is not fun. I mean, you're awake. Let's just put it that way.
I didn't know that.
And you're basically being held down, and there's this like huge needle looking vacuum, and they're clipping away, sucking out, clipping away, sucking out. And you're numb, but
No,
to
but it's-
get you numb, first of all, is painful.
Yeah.
And so anyway, when I was 20, my gynecologist actually felt a bump, and she was like, I really want you to just go get it checked out. You're young. I'm sure it's nothing. I said, okay, fine. My mom came with me, and breast cancer does run in my family. So, but I thought, I was like, I'm younger.
Nobody
this
has
probably
the
isn't
thought.
something.
No one has the thought that it's going
Right.
to be me. So.
Right. So they're doing the sonogram, and every 5 seconds she's clicking more stuff into the computer, and I'm like, oh, well, this is taking pretty long. I thought this was gonna be like a 5-minute thing. And then they said the radiologist wants to speak to you in her office, and I'm like, okay. And she asked me if I had anyone with me. I was like, my mom's in the waiting room. I'm 20, and my mom comes in. She sits us down. She goes, she basically flat out said, it looks like cancer, and we have to biopsy right away. And she said, you have four tumors in your left breast. So with that said, we're going to schedule you this week for 4 biopsies in one day. So
One biopsy is tough.
Yeah. So 4 biopsies in one sitting was my arm was numb. I can't even and I will never forget, there was a light fixture on the ceiling that had dust, and I'm watching it, and I was just like trying to focus on the dust because
Anything but
I
what
was
was
like,
going on.
yeah, and the sounds. I was mortified. Anyway, they came back benign, thank God, but they were solid lesions. They were not cysts. They were solid tumors. So from that point to now, I kept developing more and more tumors. For whatever reason, couldn't figure it out. Thank God they were all benign, but 11 biopsies since I was 20.
And what type of a scar do biopsy? Is there any scarring, anything like that that you see outside?
Yeah, you have like little,
Micro incisions?
yeah, like the size of your fingernail.
Okay.
But they place little titanium clips in there so that every time you go for a sonogram, they can see where they took a biopsy from.
So to see if something else is growing in its place.
But every time I would go for my sonos, the tech could never find my clips
Great.
because my breast tissue was so dense.
Great.
Now, that's another issue. When you have very, very dense breast tissue, as a female, you think it's great because, I hate to say it, but you have perky boobs. You think it's great, right? Not so great when you need imaging done and everything else because things are lost in there. You can't see anything.
Much harder to detect.
Yes. So then I would have to get MRI with contrast and everything else. It was just every 3 months because I was on high, like they had to constantly check me every 3 months. Every 3 months, more biopsies. Every 3 months I would go for sonos. They could not find all my markers in there. And it became
It was just a
chaos.
round robin of
Yes.
just bullshit annoyingness.
right. So finally,
Mandatory annoyingness that you had to keep going
Exactly.
for, but
Yes.
annoying nonetheless.
So then I got genetic testing because I do have a family history of breast cancer and pancreatic cancer. My Nona passed away from pancreatic cancer. And I came back with a gene mutation that increases my risk tremendously for breast cancer. Now, the most common is BRCA1 or 2. I have the ATM gene mutation, which when I heard that, I was like, ATM, am I going to make a lot of money? You know what I mean? But unfortunately,
it's gonna cost a lot of money.
meant you're going to develop a lot of tumors.
It's going to cost a lot of money. That's what it is.
Exactly. I had a breast surgeon who I was with majority of my 20s. He was a great person, great guy. I'm not going to say any names, but unfortunately, it was very, biopsy. And I'm like, this is not a way to live. And I
No.
said, let's talk about some other options here because now you tell me that I am positive for a gene mutation that increases my risk for breast cancer. I have a strong family history of cancer, and I've had 11 biopsies in one breast. To me, that says something.
Where's the treatment plan instead of just
said,
preventative?
and at the time, he said there's always tamoxifen,
What's that?
which is a very heavy medication that will basically almost like chemo in a sense.
Great.
So I don't have kids yet. Why would I ever want to do that? I would not want to put anything toxic into my body unless it was necessary. And to me, I was already thinking of a double mastectomy at that point because I'm like, I would rather take the step to fix this, that I don't have to worry anymore, than to, God forbid, have a baby and while I'm pregnant or right after because of the hormone spike. And a lot of times that will
Trigger cancer cells.
Exactly. And then I have breast cancer and I can't be with my child. And
Now you're fighting that battle.
right. And I can't wait to be a mom. That is like, love my career, but that is like my biggest passion in life is to become a mom. So it was like, which one? Do you know what I mean? Started searching around. I found an amazing, amazing breast surgeon who looked at me and he's like, you're a ticking time bomb. I was like, thank you. That's literally how I feel.
Yeah, I'm sure that helped reaffirm your
Yes.
feelings on everything.
And I went to Sloan. I went to so many different doctors, and they all looked at me like double mastectomy is a very smart choice. And I'm like, I can't believe that I didn't make this step yet. You know what I mean?